Sophie, welcome to the Big Lab podcast. How are we?
Hi, George. Yeah, really good. Thank you. How are you?
I'm not too bad. We've overcome a few technical issues, to say the least.
It's good. We've got them out of the way now.
Hoping so. Yeah, it's never easy, is it? But yeah. Would you like to give yourself a little introduction for the people listening, who you
Yeah,
are, and
sure.
a little bit about what we're going to talk about?
Yeah, sure. So my name's Sophie. I'm a 31-year-old solicitor from Manchester, and we're here today to talk about my thyroid cancer journey, um, all the way from day one through to today, which is coming up to 2 years now. So yeah.
Yeah, you mentioned the other day it's a pretty significant milestone coming on across
Yeah,
2 year
yeah.
mark.
2 year mark on Saturday it'll be. Yeah, so it'll be 2 years since the initial diagnosis, which is crazy.
That's
It's gone crazy
absolutely
fast.
flown by because I remember you first posting about this on Instagram.
Yeah, it's absolutely crazy. I mean, we've been connected for a while, haven't we? And yeah, I just remember posting about it to kind of just let people know, and it seems like yesterday, but a lot's happened since then, good and bad. So yeah, there's a lot happened in the space of 2 years, but it's gone crazy quick.
That's true. I reckon we go right back to the start then, 2 years ago. So, can you take us
Yeah.
back to the moment where you first knew something wasn't right and what happened and what made you go and get checked?
Yeah. So this is what surprises quite a lot of people actually. I knew there was a slight lump on my neck, but I'd had tonsillitis on and off and kind of just thought it was that or a swollen gland. Never expected it to be anything more severe than that because there wasn't any pain, no discomfort. And I'd gone to the dentist to have my teeth whitened, which I've never had done before, but I'd just gone into my self-employed life, was living my best life, and thought, I'm going to treat myself. Why not? Um, and before I could get the teeth whitening trays, they said that they needed to do a new patient health check, which was a standard kind of procedure. But part of that check was to check my neck. So they felt all down my neck. And during that process, she kind of paused a little bit and just looked at me and said, did you know that you've got a lump here? And I was like, yeah. Didn't think anything of it. And she just kind of said, well, I don't know whether it's anything, but it's in a bit of an unusual place. So I'm just going to put you on the 2 week pathway and refer you to the ENT, which is the ear, nose, and throat at the hospital. And that's for me was the first time I kind of thought, oh, I think this is kind of something that I need to take a bit more seriously and actually look at.
Yeah. So, what were your initial thoughts then when you were sort of referred to the ear, nose, and throat? Did you think it was anything serious or just sort of a routine?
I kind of just thought it was just going to be routine. And I didn't think that there would be anything to come of it. I mean, naturally, there was kind of a bit of a, well, what if? But it doesn't run in my family. I don't know anyone that's got this or had any kind of lumps in their neck. So for me, I was kind of like, it's going to be fine. But there is that kind of slight doubt that creeps in, especially when a sort of a dental or health person is kind of saying to you, this doesn't seem right. But I'd gone to my GP and had mentioned that I've got this because my dentist said if you go to GP, you might get a spot quicker. But I didn't actually even hear anything back from my GP for 3 weeks. And by that time, I'd already been seen by ENT. So it was quite slow on the GP side. So I was really grateful for the dentist to sort of fast track me through.
So, what was the process once you got to the ENT then? What sort of test were you having? And yeah, walk us through.
Yeah. To be honest, it all happened very, very quick. I went to the ENT and on the day I was kind of given an ultrasound. So they did an ultrasound of my neck and whilst the consultant was doing that, he just went very quiet. And in my mind, I was kind of thinking, I don't know, this just seems something seems a bit off here. And then next thing you know, he just kind of says, I'm going to take a biopsy of a couple of areas and then we'll sit down and have a chat. And my heart just sank. And I just remember thinking, this is not good news because of the fact they're doing a biopsy. I just thought, this does not sound good. And I was just lying there thinking, what is going to happen? What's he going to say? And for me, that was quite scary because I'd gone to this appointment on my own thinking it was just going to be a tick in the box. So I had no expectation really, apart from that slight hint of what if. But yeah, I had no inkling that that was going to happen, and so that to me was a bit of a shock when he said
At
that.
that point, did you have any idea of what it could be, or were you still sort of blind at this point?
Yeah, it's still quite blind because I mean, at this point, I'd never even heard of thyroid cancer. I didn't really know what the thyroid was, what it did, and I mean, to this day, I still don't know fully what it does. It does so much within the body, but I'd never heard of thyroid cancer before. So to me, it was kind of absolutely just something that I hadn't even contemplated. I didn't even know it was a thing at all.
And then, so what were the next steps after you had the biopsy? Then was it biopsy straight away, or did you have to go back?
Yeah, so they took a biopsy there and then on the spot, which was a little bit uncomfortable, but you kind of just grin and bear it, and it's going to be quick, it's going to be over, and it's going to be worthwhile, obviously doing. So they couldn't give me the results on the spot, but they did the biopsy on the spot, and then we sat down and had a chat, and he just essentially looked at me and just said, "We need to wait for the biopsy results, but I'm 99% sure this is thyroid cancer." So I got the diagnosis there and then on the day, which for a lot of cancer patients is very unusual. I don't think many cancers you can get diagnosed there and then on the spot. But the consultant I had is one of the top consultants and surgeons for throat issues and concerns in the country, which is just by luck, really, that I managed to be under his care. So he knew what he was looking at, and it was quite an overwhelming experience because that day that I got the diagnosis, I was then taken away. I had blood tests to confirm the cancer markers within my blood. I was taken to speak with one of the cancer specialist nurses, which was quite overwhelming because they give you this blue pack, like a ones you get in school, like those Polly Pocket things, and yeah, and it had all these leaflets in of thyroid cancer and what to do next and what to expect. And I was kind of just sat there as like a 29-year-old woman on my own, looking at all this stuff, thinking, "Oh my god, like this is actually happening." And I remember turning to the nurse and I kind of said, "Is there a chance that he's got this wrong? Like, is this a mistake? Could this be a mistake?" And she was just like, "Well, until we get the biopsies, we don't know, but he knows what he's looking at, and he wouldn't have said that if he wasn't sure." So at that point in my mind, I was like, "There's absolutely no doubt that that's what this is." It was just it was a huge shock, especially because it's not something I'd ever heard of, and not something that's genetic in the family. Yeah, it was just really unexpected, I think is the best way to describe it.
So
Yeah.
other than shock, then what were your initial thoughts when you hear those words that you've got thyroid cancer?
Yeah, it's it feels like quite a long time ago to go back to be honest, but I just remember initially thinking it's quite an out of body experience. A lot of people would say, how do you stay so positive? And at the time I kind of just I didn't really feel like it was happening to me, even though that's the strangest it sounds like strange to say that out loud, but maybe that was a coping mechanism. I don't know. Yeah, shock was the initial feeling, and then obviously worry and dread. And I I did cry at the hospital. I just was emotionally really overwhelmed with it, and I think that was the first couple of days was trying to understand what I'd just been told and kind of absorb it and realize, yes, this is happening to you, and this is something you're going to have to face and you're going to have to tackle. And that was, yeah, that was quite a struggle to take that news on.
I can imagine going from literally wanting to get your teeth whitened to then 2 weeks later you're getting biopsies done and being told you've got thyroid cancer at 29. I can imagine it's
Yeah,
very sort of overwhelming and, like you say, almost like an out of body experience.
yeah.
So then take us through to the next step then. So Obviously, you've been sort of told that you've got it, but it's not quite 100% because you've not got the biopsy results back. Talk us through that next step then.
So there was a little bit of back and forth after that. I don't know what quite happened with the first biopsy, but it didn't go as planned for whatever reason. And to be honest, I think because I was just still in a state of confusion, I didn't really ask any questions. They just said they needed another one, and I said absolutely fine, just do what you need to do. I had a local anaesthetic that time because they took more. They used, it was almost like a gun mechanism where they push something into your neck and they use a trigger so it clips off more material, more tissue. And that was quite painful for a couple of days after. I did have a bit of a sore throat
Can
because
imagine.
they actually go through your neck. Yeah.
Wow.
So I did have a bit of a sore throat for a couple of days, but it was absolutely manageable. You know, it wasn't too terrible. And then shortly after that, they just kind of confirmed that it was what they thought it was. But in all honesty, I don't really think I ever got an official letter from, well, I must have got a letter at some point, but I don't think at that point they gave me like an official, yes, it is this, and here's what you've got. It was a lot of back and forth, and I can't really remember why now, but yeah, it was just, it kind of seemed a bit hazy, but that could have been just, again, how I was coping with things at the time, because there was, you know, my whole world had shifted and there was all this fear, confusion, and you just have 1,000 questions to ask. And you're just thinking, oh my God, like, how is this going to change my life? How is this going to impact my future? Um,
Was that sort of
yeah.
communicated to you by the doctors how it was going to impact you going forward, or like from the point of actually it being confirmed, like then you've got the next steps, which we'll get onto, but how how was that sort of communicated to you?
Yeah, the consultant surgeon, he was actually my surgeon as well. He was really good. He was very to the point, but I quite liked that. I liked that there wasn't any beating around the bush. It was straight in there. But yeah, he just kind of explained, you know, you're going to need surgery. That's kind of going to be the route, and you might need further treatment after that, which I did need in the end. But yeah, he kind of explained that in terms of your health, things are going to be a little bit different. Um, and yeah, just kind of the limitations that I will have health wise because of it, and the need for future medications and all that kind of thing. So I I did get a really good um overview of what to expect going forward from the consultant. The specialist nurses were always really on hand. And even way before having any kind of treatment, I met with the physio who was going to be looking after me, and she ran me through everything as well. So even before I'd even got down very far down the road, you know, I was seeing all these different people, and I was taken care of very well, I would say, and I really understood what my path was going to look like in terms of recovery.
Sounds like you were in good hands at least to going
Yeah.
from having a really good consultation and then obviously that handing over into your surgery. So walk us through what kind of surgery you had. How did that happen? What are the sort of timelines from obviously then the 2 weeks after when you've had the initial biopsy? What sort of timeline
Yeah.
are we talking?
So within, I think it might have even been a week and a half, I was seen after being sent over by the dentist for the original consultation at the ENT, and then it was 7 weeks to the day from that consultation that I had my surgery. So it was very quick. Um, but I'm really super grateful because I had a very, very good experience with the NHS, and this was all under the NHS. Um, I really can't complain with how I was treated at all, and I know not everyone gets that experience. So I do feel very fortunate. But yeah, 7 weeks to the day I had my surgery. When I went in for my second biopsy, I didn't have a surgery date then, but they sent me in for my pre-op and for all my bloods and all that, all the kind of testing they do, just so I didn't have to go back again, because they knew that the surgery was going to be coming around the corner quite quick. So it happened at a really big pace. But I remember there was kind of like a 3 or 4 week gap from seeing anybody at the hospital to the surgery. And I just remember thinking, oh my God, like I want this waiting to be over, because a lot of the time what people don't realize is the waiting can really be a huge part of the mind games
Yeah.
that you kind of have to face. So that was like a huge challenge. But yeah, I can't complain, because in the grand scheme, 7 weeks from diagnosis is a crazy turnaround. It's really good.
Yeah. No, that is really good. So,
Yeah.
what type of surgery was it? Was it full or partial thyroidectomy?
Yeah, sorry. So it was I'm chattering away. It was the full thyroidectomy. So I mean, you can't even really see the scar now. It's quite thick here,
Yeah.
but down here it's quite
Not very
thin.
noticeable, is it? At all?
Really, really discreet. And so I had a full thyroidectomy, like total. So the whole thing was taken from here. So there's like a line there. And then I also had a lateral neck dissection, which they removed 120 lymph nodes. Not all of those were cancerous, but I think about 20 of them were. So I had a small lump on the thyroid, so they took the whole thing, and then the lymph nodes on the side, which is why I've got this big portion of scar down here. So it's quite a lot bigger than just the normal thyroid cancer scars because of that. Because it's quite an invasive procedure to go through the side of the neck, which causes issues with the shoulder and things like that. So they do kind of warn you of those risks as well before you go in.
So, you say that they took, what was it, 120 lymph nodes? What was the reason for
Yeah.
taking so many if only 20 of them were cancerous? Was it a precautionary thing, or?
Yeah, I think a bit of it being precautionary, but also I think sometimes they can be quite difficult to get to. So it's kind of they have to take some out to get access to others. So yeah, that it was. I think it was more because some of them they were a bit unsure about, or they looked like they could potentially be a bit bad. But I think when they took them and did testing on them, it turned out that they were like most of them were okay. Yeah,
I guess it's better to take them out than they'd be okay than leave them in and then potentially not be.
that's it. Because I think the you run the risk if you leave them in of needing further surgery, and obviously the less surgery you can have, the better. Which is why most of the time now I believe they will take out the full thyroid, because you have medication now that can replace that. I mean, obviously it's not ideal, but you have medication that can replace the thyroid hormone.
So, you had the surgery. How did you feel when you woke up from it, and like in a physical sense and a mental sense?
Yeah, I'd had, because I'd luckily been able to speak to the physio, I kind of was feeling okay about the recovery side of things. The part of the risks, a lot of the risks that were the high risk are losing your voice permanently or temporarily, partially losing it so you get a raspy voice or a hoarse voice. And other risks include, not especially with the lateral dissection through the neck, not being able to move your shoulder, numbness, and not being able to move one side of your face. I was very fortunate that I was well. One of the first things I did was lifted my arm and like moved my mouth to smile to check that I could still do that. I remember waking up. That was the first thing I did. It was like an unconscious. It was like an unconscious decision. I just did it, and I was like, "Oh my god!" I was like, "I could move my arm." But I remember thinking after sort of a day, my shoulder and neck and my face still here, and my ear is all still numb. And I remember thinking after that sort of amount of time, I was thinking, "I'm not sure this is ever going to come back." And one of the nurses had said, "Oh, maybe it's just the way they lay you on the table." And I was thinking, well, I wouldn't have been laying on my right side because that's what the side they were working on. But um, when the consultant came around, he just kind of explained, like, yeah, that might never come back. Up to 2 years, the nerves can repair themselves. It's basically nerve damage, which is why it's numb. But anything after that, the nerves are unlikely to knit back together, basically. So that's probably something that I will live with forever now. But I'm kind of used to it. Sometimes it feels a bit frustrating, but it's one of those. It's I'd rather this than the alternative. So it's one of those, really. But yeah, mentally that was quite daunting, just hearing that you might not ever get the feeling or the sensation back. Luckily, most of my arms fine now. It's mainly sort of shoulder upwards, really. But yeah, there's always going to be a slight weakness in that shoulder, I think, which is it impacted sort of how I train in the gym and things like that. And so mentally dealing with those kinds of things has been quite hard. But then, like I say, on the flip side, I was very fortunate just to get away with having some numbness really, and still having the ability to move my face and to move my arm. That for me was just bigger than anything else, and not losing my voice as well. I don't even think I had a sore throat after surgery, which I was really shocked by. Not straight away. I think after a week I did. But I remember being really shocked. I was thinking, how have I had surgery all down here and up here, and my voice is okay? But yeah, it was it was quite scary waking up. But I was just glad to be awake and feeling that I'd got movement in my body. And within a couple of hours, I was up and walking around. Not very far, but I could move. I could move a little bit. So I was just grateful for that at that point. It was just the little things at that time.
So did that have sort of a positive effect then from waking up? You say you were able to sort of move your arm, you had a little bit of numbness, but you could still sort of do things. Did that put you on a positive sort of track to begin with?
Yeah, massively. I think just that initial relief of being able to particularly move my arm and my mouth, and that for me was that was huge, because that was something I was really worried about. I Before I'd had the surgery, I was really concerned about what the scar would look like, and how big it was going to be, because I knew it was going to be, all the way down the side of my neck and across. And I thought, oh, it's going to be huge, and what are people going to think? And now it doesn't faze me at all. I actually quite like it. It's part of the story. So yeah, that dealing with all of that was quite before, it was quite mentally challenging. But I think that was more. It's more preempting what it's going to be like. It's more the unknown than actually it happening. Sometimes it can be scary.
Yeah, so I guess you sort of knew there was going to be scarring, but you didn't know whether you're going to be able to move your face, your arm, your shoulder. Yes, yeah,
Yeah,
those unknowns could be pretty daunting, especially if it's going to be after waking up from a surgery. It's not something that's sort of happening there and then. You're asleep and then you wake up and you don't know until you obviously try.
that's it. It's the fear of the unknown, I think, and your life is in someone else's hands at that point. But I was kind of like, you just have to go right through it. You don't really have an alternative. Like it's life or death at that point. So you kind of just think, I've got to do this. And um, I just remember thinking, like, if it doesn't turn out the way I want it to, then like there's something I can always do. And there's positives in it. You can find positives in every situation. So I was just thinking, just get through this. And if you've got movement and you can move your mouth and you can do these things, that is just enough in itself. Like that's all you need. You don't need anything else at this point. Just focus on little wins, little steps, to eventually, start that road to recovery and get where you want to be.
Yeah, I will say you were very positive over social media again. Whether that was a coping mechanism, I'm not sure, but if it works, it works.
I've got to admit, I'm quite an emotional person. I'm quite sensitive. I'm a quite sensitive person, and um, I don't know. In all honesty, it probably partly was a coping mechanism. Don't get me wrong. There were times where I was very sad, and um, I found it really, really difficult. But I had the most supportive family and friends around me, and little Thor, my sausage dog, um, and that really, really helped, because I had such a great support network. And posting on social media was kind of I didn't know whether to do it at first or not, and then I thought, well, there's people on there who I don't perhaps speak to all the time, but would want to know this. People who are not in my close friend circle, but like would want to know about it. And I thought, well, yeah, I'll share it, and if I can help people along the way, then it's a bonus. And yeah, partly it was a helpful distraction in a way, to kind of detract from something that was quite painful and sad, to try and spin it in a positive light and find something to find something else to keep you going, I guess. In those moments where you've gone from being a very, very active person to being told you can't walk any more than 5 minutes a day. This is coming from someone who was gymming 4 to 5 times a week, walking a lot with the dog, I was told I shouldn't even walk 5 minutes a day after surgery. Um, it's a lifestyle change hugely to start with.
I can imagine. It's a major surgery,
Yeah.
isn't it? So
Yeah.
obviously you've woke up from the surgery. Then what's the recovery process? Talk us through that sort of first week or two after surgery.
Yeah, so I was in hospital for 5 days in total. And that was quite tough, in some ways because you I was still very weak. So walking around, even after a couple of minutes, I'd get quite shaky and I'd have to go back and sit in bed. There's obviously pain. They can give you pain relief, but um, sleeping wasn't very nice because I had to sleep on my left side because the all the staples and the stitches were in this side. Um, so it was just trying to find the new normal, finding that balance as well. So in those early days, that was probably the thing I struggled with most, was the sleeping, and just not being able to move an awful lot. But to be honest, a lot of the time I was also very tired, so I did just I was in and out of sleep quite a lot. Um, but the hospital food was good. I had 3-course meals, three
Can't
course meals
complain.
every day. I I honestly, I really enjoyed it. Yeah, it was good. I
Not
got
having to
treated very
cook or
well.
clean.
Yeah, it was good. But yeah, on a serious note, they did look after us very well. But yeah, it's you kind of meet people in there who are in probably, I would say, a worse situation than what you're in, really. There was a woman in there who had a brain surgery, and she'd got the doctors to record it for her, which I thought was crazy.
Wow.
But I didn't see any of the footage, but they came in and gave her phone and said, "Oh, here's your phone, and we've recorded it." And I was like thinking, "Whoa, that's insane." But
Yeah, I
brain
wouldn't. I don't think
surgery.
I'd want to see that.
No, I thought the same. I kind of thought, oh, that's quite a cool idea. And then I was like, actually, no, I don't think I'd want to see it. I wouldn't
I'm
want to
bad
know.
enough with needles, so there's no chance I'd be able to watch that.
Oh God, you'd have hated it in the hospital then, because
Mm,
I think there was blood tests like every hour. So it got to the point where I had to
yeah, I
say to
wouldn't be able
them,
to do that.
yeah, I had to say to them, I said, can you just use my other arm? I said, because it was so sore. I was like, you can't put
Imagine.
anything else in there. I was like, you can't. But yeah, the hospital
So
recovery was okay.
you mentioned that you'd already spoke to your physio beforehand. What was the process of going through physio after surgery?
Yeah, so they kind of said, I think it was give it like 8 or 10 weeks or something like that before we start the physio properly. And what we did was we kind of, well, she sort of set out a plan. So we gave it sort of I think it was 8 or 10 weeks, something like that. And we basically took it really, really slow because what had happened is because all the nerves have been severed through the neck and there's all this damage, it sounds really stupid, but you kind of hunched over. And it's the physio kind of described it as like you're kind of like protecting yourself. So you had
Right.
like your surgery here, so you kind of like hunched up like this. Because it feels quite unusual. And it's all tight because you've now got scar tissue forming. So it was a lot of neck stretching and just trying to find balance again as well. And a lot of Pilates movement actually, which I actually really enjoy. So that to me wasn't a hardship at all. But it was quite difficult being told basically you can't go back to the gym yet. Um, that was difficult because you've gone from doing it, like I say, 4 or 5 times a week to being told like no, you can't do it. But in my mind, I was like, look, long-term goal here. Let's listen to what they're saying because you don't want to run the risk of pushing yourself too hard and then being out of the game for even longer. So I was like, look, we'll just stick with the Pilates. I like Pilates anyway, and we'll go from there. But that's kind of the road we took with her. But saw her for a few months. It was quite a long time before my posture came back to normal, and even now there's still like quite a bit of weakness in there compared to the other side when I'm training, but I can train near normally now. I don't do things like squats because putting any weight or barbell on my back doesn't feel good for the shoulder. Um, and yeah, so shoulder movements, I lift a lot lighter. Upper body, I don't train as often now because of that, but I still do try and train it because I think it is important to try and rebuild that strength. So trying to mix it up with a lot of things like pull-ups, dips, just more
Yeah,
natural
there's
body
plenty of
movements.
different exercises that you can do, isn't there? The main
Yeah,
thing. So how
yeah.
long was it before you were back in the gym then? You mentioned you were doing Pilates for a little while, but how long was it before you actually got back in and started lifting?
It was a long time. I'd say maybe, trying to think when it was now. So I had my surgery in the September. It was probably February time before I was back in the gym, I would say. So it was quite a long time, for 4 or 5 months, is that? Yeah, 5 months ish. And I did actually, against the advice, go back a little bit earlier and injured myself, not terribly. And I just thought, I knew I should have listened. I know I should have listened to what she said. So I didn't push it and go crazy with, like, in terms of going back after like a couple of months. I did leave it until sort of like January, early February. And I was like, no, this isn't for me. And then I scared myself then because I was like, oh, I've injured myself. This is really bad. I don't want to go back. And you have this kind of thing like, oh yeah, I'll be able to do what I did before, but in reality that wasn't going to happen. You've got to start from scratch again with something like that. And especially when your posture is completely changed and you'll have lost a lot of muscle mass. um it's kind of learning to just listen to your body was a huge thing for me. And luckily I didn't injure myself too badly. It just tweaked it for a week or so. It was just a little bit sore, but it was enough to put me off. But yeah, so I definitely changed my training after that. And I just had to. Yeah, it wasn't any choice.
Yeah, from that point of view, I understand where you're coming from because I've been through knee rehab, I think 3 times,
Yeah.
and
Wow.
I was constantly asking my physio, when can I go play football? When can I play football? And he was like, in a couple of weeks, in a couple of weeks. I ended up going back playing football, and I had to sort of. Luckily, I didn't injure myself. There was like a little crack in my knee, but nothing too bad. But I had to sort of tell him, sorry, but I played football this weekend against you telling me not to.
I was going to say,
But
I bet that didn't go down well.
yeah, no. Well, he was a little bit disappointed, but buzzing at the same time that I wasn't injured. I think I managed
Yeah.
to score as well, so I think that sort of let me off the hook a little bit. But yeah,
He's proud of your goal.
yeah, going back a little bit too early, I can definitely understand. But I think it's human nature, isn't it? We sort of think we know better sometimes, especially with our own bodies. But we live
I
and
think,
learn.
we do. And I think the motto of both of those stories really is you've got to listen to your body. You've got to learn to listen to your body. And you've just got to be patient with yourself and celebrate progress, even when it's slow, even when it's little wins, because progress is progress at the end of the day. And I think that's a really important thing to take away from both of those stories.
Yeah, exactly. Like you've got to think this is the rest of your life. Like
Yeah.
the to wait a couple more weeks is nothing in the grand scheme of things. So you touched on before thyroid medication, which I believe now you take daily. Is that right?
Yes, yeah, that's it. So levothyroxine, yeah. So that's essentially a hormone replacement therapy drug, which is something that I'll take forever now because I've got no thyroid. I need something to replace it. The thyroid does so much within your body. I couldn't sit here and list it all, but to give you a few examples, it regulates body temperature, metabolism, liver function. It impacts brain function. It's huge. It does so much within the body. So getting that levothyroxine level correct is a minefield. It's up and down, and it's something that will now seems quite level, seems quite steady. But there are occasions where sometimes you can feel a bit odd, which might display as things like dizziness or extreme fatigue, feeling cold, hands and feet are either cold or really hot. You can't manage your body temperature all that well if your levels are slightly wrong with your medication. So all these kind of symptoms um, are things that you then have to learn to cope with. And at first, it was quite scary for me when I didn't really understand why these things were happening. I remember going to hospital a couple of months after surgery, and I was like, I don't know what's happening. I was like, I feel really weird, but I can't describe to you why, like, what's happening to me. And after waiting for hours in A&E, well, actually, I ended up going home because they couldn't do blood tests at the department for some reason. And then I got seen the next day. But yeah, and it turned out that my medication levels needed to be adjusted. So you have well, they have like a kind of set level of what they expect your what's called TSH or T4, which is how they measure the thyroid function and the hormones. They have a set level of what the norm range is, and you kind of, generally speaking, need to fit into that norm. Not always, because not everyone's normal fits within the normal for the UK. You might sit a little bit lower, you might sit a bit higher, depends how you feel. And often what they will do is they aim to get you within that range. But if you feel a bit unusual, a bit unwell, or say your range is slightly out of that norm, then but you feel okay, they won't necessarily change your medication. So it's a bit of a numbers game. I think I'm at a point now where it's okay. Before Christmas, they did find another lump, which has turned out to be what they think is scar tissue. I'm just on monitoring for that now. But what they did to try and suppress the growth of that was adjust the levothyroxine hormone, because it basically stops the growth of any thyroid tissue. So the thinking behind that was, well, if it is thyroid tissue or it's cancerous thyroid tissue, we'll try and suppress the growth with it. But part of the downside to having an increased dose of that levothyroxine was um, it increases your metabolism. So if you're on a very high dose, which some people will be like, oh, well, it's great because you can lose loads of weight, but in reality, it doesn't just impact that. So I was noticing things like hair loss and just generally not feeling very well, very shaky, very dizzy, and all these different things. And for me, the hair loss thing was huge because I was, I'd gone through this whole process with keeping my natural hair, and I'm very fortunate to have quite thick hair, but I started seeing it thinning out, and I was like, oh my God. I was like, no, what's happening? What's happening? And we've reduced the dose again now, and it seems to be evening out, but there can be some quite scary side effects to it. So it is a bit of a process. I mean, obviously that was a deliberate tactic to try and suppress any tissue growth. Um, but yeah, it's a numbers game, and it can make you feel quite unwell. And it is hormone replacement therapy, so your hormones are going to fluctuate, and getting used to those hormonal changes is quite crazy as well. I
So
think
is
they've
this
been,
something that you can't sort of test at home? You've got to go to the hospital to get your bloods done to then them to run a test. It's not something that you can sort of sit at home and go, this is why, like, say, I guess like with diabetes, when you do like the finger
yeah.
pricks, it's completely different and you've got to go to a specialist, I assume.
Yeah, so unfortunately, it's not as straightforward as doing like a diabetes test type thing. But you don't have to go to the hospital, which is good. You can just get it done through your GP. So
Right.
I will just have them done usually between 6 and 12 weeks, depending how I'm feeling. If I'm feeling okay, I don't tend to get them done. There's no need really. But yeah, you just contact your GP and you basically get them to do a blood test form for you to check the levels, and yeah, then the doctor will sort of review it and come back to you with any comments on what they think. If they think that you need to tweak the dose, they'll ask you if you're getting any symptoms. And yeah, that tends to be how it works. But usually, I mean, they say every 6 to 12 weeks, but usually you'd kind of only go and do it if you had some symptoms that were making you feel a bit uncomfortable, because otherwise you don't really need to adjust the dose.
So do you adjust the dose yourself now, or do you still sort of go off a sort of doctor's report?
Yeah, I would always say to anybody to consult with a doctor before changing their dose, but you do get used to what suits your body. Um, I was told fairly recently by one of the consultants, who was one of the more junior consultants, to increase my dose back to the 150, which is where I was experiencing hair loss. And I didn't agree with that because I knew how it had made me feel, and the symptoms I was having, the hot flushes, not being able to sleep because it does affect sleep as well, the hair loss, the temperature fluctuations were just crazy, and I just knew for me that that wasn't the right dose. Um, so I reduced it myself back to the level that I felt good at, and at the moment it seems stable. it can take up to, I think it's 6 weeks for any dose change to take full effect. So it'll be in your system, but it's quite slow to build up, if that makes sense. So
Yeah.
you'll have it in there, but you might not feel the effect of, say, if you reduce your dose, you might not feel the effect of that straight away. It can take a couple of weeks for it to get into your system and change any symptoms you're having.
Which I assume can also affect you sort of mentally, knowing that you make a change now, you may not see the benefit of it for another 6 weeks.
Yeah, hugely. And that, with the hair loss that I was starting to experience, that mentally was a big thing for me. And that's only fairly recent. That was in sort of January, February time that started, when the dose got increased. So yeah, for me, that was quite a recent challenge, and that was a bit of a struggle. Fortunately, managed to sort of stop it before it got too severe, because I realized what was causing it. Because I was trying to think, I was like, is it my shampoo? But because at first it wasn't my initial reaction to think, oh, it's the medication. And I was like, oh my god, is that's what it is? Because it speeds up your metabolism, and it increases the hair cycle, so your hair falls out more frequently than it would otherwise, because your metabolism's working quicker and your body can't keep up, essentially.
Yeah, that makes sense.
Yeah.
So actually, I've just thought of another thing. Post surgery, did you have to go through any sort of chemotherapy or radiotherapy, or was it just the surgery and then sort of the recovery process after that?
Yeah, sorry, I feel like I skipped that bit, didn't I? So I had the surgery, and then so that was in September 2023, and then the following February 2024, early Feb, I had what's called radioiodine therapy. Chemotherapy doesn't actually work for this type of cancer. I should say, though, that there are 4 different types of thyroid cancer. I had the least aggressive one, which is papillary thyroid cancer, but there are 3 other types as well. I'm not too sure on the position where the chemo works for those, but for this particular type of thyroid cancer, chemo won't target the affected cells. So even if I underwent chemo, it wouldn't have done anything, basically, apart from have the other negative side effects on my body. So I had radioiodine therapy, which essentially only targets thyroid cells. So it would what happens is you have your surgery, they remove the thyroid, and then you have this radioactive iodine therapy, which essentially works to target and mop up any thyroid cells that are remaining after your surgery. So it's kind of like a mopping up. That's what they described it to me as, a mopping up of any thyroid tissue. So you are radioactive, and it's quite a bizarre experience, because you go into hospital, and again, I had to isolate in hospital for, I think in the end I was only in for 3 or 4 days, but they say up to 5 or 7 days. And they bring it to you in this lead case, and they twist the cap off, and they're all kind of behind a screen because it's radioactive. And I'm thinking, I've got to put this in my body. And they kind of unscrew the cap and they pour it into a cup, and then I was about to drink it, and I think I was about to pick it up, and she said, no, she's like, don't touch it. And I was like thinking, why can't I touch it? Like, I'm about to swallow this.
You
And I had to
drink it
drink.
as well?
Yeah. So you have to
Wow.
drink it with lukewarm water, which is vile, like tepid water. And yeah, it was like something out of a film. And then so you take it, and then you have to lie on this bed, like a hospital, because you have your own hospital room with like a bathroom
Right.
on your own, because you're not allowed to be around other people. But yeah, and you're lying on this bed, and there's like I think they call it a Geiger counter, like even in the
Yeah, yeah.
hospitals. But there's like a Geiger counter above the bed. So you're lying in bed like this, and they do like a full body measurement of to see what your Geiger reading is. It's bizarre.
To see
It's
how
the most bizarre.
radioactive you are.
Yeah.
Wow.
And they were like, it's worked. It's in there. And I was like thinking, great.
So
So that was
what's
quite
the
bizarre.
process after that then?
So then,
Is that
yeah,
just a one-off, or?
yeah. So sometimes people may need to go through that another time. They might need a couple of sessions of that. Generally, it's once. But sometimes if it's not quite got everything, they'll go back and do another session. I only needed it once, so for me that was absolutely fine. But yeah, sometimes it's a case of needing more surgery or more radioiodine therapy. But fortunately for me, I didn't need either. But yeah, so after that, you spend your time in hospital in isolation. They'll do a full body scan again, they'll do. I think it was a CT scan where they check to see where the radioiodine was still sat, because even after 3 or 4 days, you're still radioactive at that point. So I had to isolate at home and stay away from people, particularly pregnant people, young children, things like that. So I was kind of like isolating at home a little bit, which was fine. Um, but yeah, it was quite a surreal experience, that. But yeah, I mean, I hopefully I will never experience anything like that in my life, but it was quite an experience. It did feel like something out of a film. It was bizarre, the most bizarre thing.
I can imagine.
Yeah, and
Especially
they
with
bring
like
you.
people like behind screens giving at you and things like that. That's crazy.
Yeah. And because obviously you can't leave the room, you've got like your own little ensuite and everything, but they have to bring you your food and they put it on like a tray, and then they'll come, it's like a screen near the door, like a trolley
No.
thing, and they'll come and bring it, and they'll like put it round, but they're all like wearing masks, and like not like full on masks, but just kind of
Yeah,
like covered, their faces covered a bit. But yeah, just to protect themselves, they have like these screens up. So yeah, it's quite bizarre. Yeah.
can only imagine.
But
Wow.
I thought I'd be really bored, but I didn't feel sick from it at all. And fortunately, you don't lose your hair with it. That's not
No,
one of the
that's good.
side effects. So, because that, I think for me, I think especially, I mean, for men as well, but for me as a woman, like I would have really struggled with losing my hair. That would have been really, I can't even imagine what that must feel like. That must be quite a difficult thing to come to terms with. I think you'd feel like you'd lost a bit of your identity, maybe. Um, so yeah, for me, I was super grateful for that. But yeah, very bizarre experience, very bizarre.
Hopefully, something that you only have to experience
Yeah,
once.
fingers crossed.
So, moving on then to obviously, you've gone through the recovery process. You've now started up the Butterfly Care Collective. Tell us about why you started it and sort of what inspired you to start it.
Yeah, wow. To be honest, it kind of started with this whole concept of turning pain into purpose. And going back to what I said before, if I could help one person with posting about what I was going through, I would feel like I've helped somebody. And if I can then, turn my pain into something good and help someone, that for me would be enough. And it also, with the whole idea of it being a collective, was kind of to create a sense of community. So a sense for other people who are going through similar things, or people's families who may not know how to talk about it with their loved ones. Just a safe place where people can go and talk about these things, and it not feel so scary, and people can talk about it openly. um I just didn't want people to feel alone in it. And when I kind of first got diagnosed, like I said, I didn't know anything. I didn't even know it was a thing. I didn't know thyroid cancer was a thing. Didn't know anyone who'd been through it. But then as soon as I started posting about it, even people that I already had on my social media messaged me and said, "Oh, I've had this," or my friends' aunties had this, or there was people that were coming to me and saying, they've been through something similar, or they knew someone. And I wanted to give people a sense of belonging, but also it gave me that too. It was like a reciprocated thing. And I've probably spoken to 5, 10, mainly women actually, who have gone through the same thing. And I mean, I feel quite grateful to be able to talk to people about it and hopefully help them. And there are some people that have been through the process and have come out the other side now, and they've helped me. So it's kind of just it's like it's almost come full circle, really. There's like that ability in the community to help others. Um,
Yeah, I
yeah,
guess like it's important for people to know that they're not the only person to have gone through this, and there's obviously space to learn from others that have been through it. Like you said, if you post,
yeah.
if like your posting helps one person, then it's doing its job. I mean, I kind of get that from why I started my podcast and my fitness account back in the day. Obviously, it's a completely different topic, but I always said like it might not reach a load of people, but if it helps one person, then it's doing the job.
Oh, 100%. I think just having that safe place for people to share their stories, find some resources, and just feel seen. Because often thyroid cancer is referred to as the good cancer, and that can feel quite dismissive sometimes because it is so curable. It's 90% curable for papillary thyroid cancer, which is why, the outcome was so good, and probably partly why I was so positive about this whole experience generally. But and to be honest with you, I used to refer to it as the good cancer until I went on a patient day with other patients that were going through the same thing. And I thought, yeah, maybe I need to stop calling it the good cancer, because cancer's cancer. And I think that, there were, I had seen things where people were basically saying that it was good cancer, and it kind of made it feel like it was less than what it is. But having that space where people can share their experience and know that their experience is valid and that their feelings are real, and you deserve support. Cancer is cancer at the end of the day, and yes, it has a very, very high success rate of being cured, but it's still a huge life-changing process. And you do really need to you have to redefine yourself, really, when you come out of the other side of it. It does change you, physically, mentally. You've got to look. You really have to look in the mirror and, yeah, just kind of confront who you are when you are stripped back to basics.
Yeah, it's one thing getting obviously the support from the doctors and the nurses, and they're obviously working off science and facts and stuff like that. But I guess seeing other people, like real life people that have gone through it, and being able to sort of relate to those stories, and maybe someone's not quite as far in the journey as you are, and the other
Yeah,
way around, you can see the sort of path that you may end up going along.
that's it. And I think it's good, because some people may struggle with that sense of identity when they come out the other side, not knowing where that path's going to take them. And part of my journey, I discovered something called kintsugi, which is basically a Japanese um, art which repairs broken pottery with gold. And I really was taken by this concept, because I was thinking, this is really cool. This kind of is relatable, because the cracks basically are, they're not hidden, they're honored, they're filled with gold. It's a very beautiful art form. And essentially it's this whole concept of the broken piece becomes more beautiful because of the history of what it's been through, not in spite of it. And that, I think, is so relatable to anyone's journey who goes through something like this, any kind of cancer. And yeah, I think having that sense of community in that in that way is just a great thing. But that really struck me when I learned about it. I thought, wow, so relatable.
I think that's a good concept and analogy just generally for life, though, isn't it? At the same time, like
Yeah.
that, you're going to have ups and downs, and that sort of shapes who you are in a way. And you can either decide to let that define you in a good way or a bad way. Like, obviously, I've not been through what you've been through in terms of a cancer recovery. I've had multiple injuries over my time playing football, so
Yeah.
I've had to sort of deal with a lot of that over the times. And yeah, each one, it doesn't necessarily get easier, but you know the process of what's coming next. And yeah, it's all about doing what you can do and not necessarily letting it define you in a way where it affects you negatively. And I think you've done that very well. Like I said before, you've been very positive over social media, whether that is a coping mechanism or not. You've still been positive.
I think part of having that community has really driven me to be positive for other people. And um, this might sound crazy, but to start with, I was really concerned about how my friends and family were going to feel. So
Right.
yeah, I was hella scared. Like I didn't know what was going to happen. There was so many unknowns, and you read things online, and I stopped doing that because I thought that was just a silly thing to do. But I was really concerned about how everyone else was feeling. And that sounds really stupid. Well, maybe, I don't know, maybe it does, maybe it doesn't. But at the time, I was like, I just want everyone else to be okay. And I don't know. And then, but that kind of, maybe that was a coping mechanism too, because I was more focused on how everyone else was feeling. that
Sort of take it away from yourself.
yeah, I didn't want to dwell on
Almost
it.
selfless in a way.
Yeah. Yeah, mate, I don't know. I really don't know, but I just remember having to tell my family, and some of my brother and sister live in Australia, and I just remember having to tell them, and it was like the hardest thing to do, having to break that to them over the phone. And I didn't want to tell them over the phone, but I had no choice. It was, yeah, it was that was quite difficult, but I was more worried at that point about how they were feeling than anything else. I didn't want to upset them, which sounds stupid because they're obviously going to be upset. I mean, it's natural, isn't it? But
So how did they take it
yeah,
then? The family when you told them?
yeah, I to in front of me they were very, very strong, and we obviously had moments where we um we were upset and we spoke about things. We had those deep conversations, but on the whole, in front of me they were very, very strong, and I think that was probably them trying to reassure me. I imagine at times when I wasn't there, the conversations might have looked slightly different. um I can only guess, but um yeah, they took it very well, and I'm very, very close with my family. We're very, very tight knit, so it was tough. It was really tough telling them, but at the same time, I knew that they were just going to be my rock through all this, because if you can depend on anyone, it's your family. Like they've been there for me through absolutely everything, and I just there's nothing I can ever do to thank them enough. Because they were just absolutely amazing. And I look back on it now and still think, wow, like, yeah, very, very selfless, very caring people. I'll be forever grateful for that.
I think that's something that a lot of people, just in general, need to do is sort of fall back on the support circle sometimes. Like I speak a lot about mental health on the podcast quite often, and using those support networks that you've got are key, especially through some of your maybe lowest moments, but also your highest moments as well. So yeah, I think having that support circle there obviously is very, very helpful through those sort of times.
Yeah, massively. And I think if anything, I should have relied on them more. They did more than enough for me, and I think I was quite afraid of not wanting to show them how worried I was or how I was feeling. And not that I locked it down, because I do express myself, like I'm okay expressing myself. But yeah, for people that really do struggle, I think it is a really important message to be okay with talking about it, because the people that are in your support circle, they're the people that love you the most, and they're going to be there for you through thick and thin. And if ever you need someone, it's in your time of need. These are the people that you're going to want around, and they, if anything, they want to help. Don't be alone in this, because you're not alone. So I think that's a really key takeaway, I think, for anyone going through anything, whether it's cancer, illness, health, anything.
Yeah, bottling up's the worst thing that you can do, isn't it?
Yeah,
And
yeah,
yeah, yeah, people need to speak up a lot more and realize that they're not the only one going through whatever they're going through. Someone's been through it before, and you can use those experiences to help you get through the next steps. So, how how would you say that it's affected your mental health and your sort of outlook on general life since going through this journey?
oh, really good question. I think if anything, if it's taught me anything, it's taught me that we are so much stronger than we think. Like I said before, I'm a very sensitive person, and I get emotional, I get upset, I like anyone, and there were times, obviously, when I did get upset about this, as you would. But I think I surprised myself. A lot of my friends and family say to me, Sophie, like, I'm a bit surprised at how well you handled this. And I'm like, me too, because I honestly thought something like this would have not broken me, but I honestly thought it would have, affected me a lot more than it did, um, mentally, because it's a huge thing to go through. But I honestly think having that sense of community, whether it's your friends, your family, who are your real, support circle, or having an online community like the Butterfly Care Collective where you can talk to others about this, for me, that's just so powerful. And that really, really helped me. But I think this just showed me how resilient and how strong I am. And if I can get through this, like, send anything my way, because I will beat it, like, I think I saw a clip from Angelina Jolie, like around the time that I was going through this, and she said something like, "For anyone going through a hard time, just go straight through it." And that's exactly what I did, and it was probably some of the best advice I've ever received, because it was kind of like, don't dwell too much on the little things and things you can't control. Let it happen, let it be. Just deal with what you can control. Take a step at a time, and it's just really taught me how to build that mental resilience and push through things where they are challenging, they are tough. You're gonna have difficult days. It's part of the course, isn't it? But just really pushing right through it, going right through it, and tackling it head on, and proving to yourself you're stronger than you think you are.
So would you say going forward then that it's made you sort of go for things a lot more now, sort of saying yes to things, or if there's something that you want to do, that you go and sort of do it? Would you say that has happened off the back of this? To give you
Yeah,
maybe not like a sense of urgency to do things, but to just go for it?
I got to a kind of point in life where I was kind of, very settled. I'd just gone self-employed, and I got a house, I got a good car, like, I've got my dog, like, I feel like I'd ticked off a lot of boxes for myself, and I was really happy. I'd done everything that, like, I kind of wanted to do, and I kind of thought, oh, like, where do I go next with this? And um, you know, I, things changed, and my job's changed and things like that. But now it's kind of pushed me to. I've got to a place where I'm like, no, I'm not gonna. If I'm not happy with something, if I don't enjoy something, or I'm not gonna waste my time doing that. I'm not gonna waste my time on anything that doesn't bring me happiness, peace, or satisfaction, or if anything negative in that sense. I'm gonna strive for things that maybe a little bit out of reach, maybe out of my comfort zone. But a lot of my ethos kind of changed to say yes, figure it out later. And I'm not saying, and I'm not saying here, quit your job and just figure it out. Don't take that advice.
Within
But
reason.
within reason, like, I think, say yes to things that are not going to put yourself in danger, not going to put yourself in terrible financial hardship. But, like, saying yes to things that you wouldn't perhaps have said yes to before, and really pushing for it, and thinking, do you know what, like, there's a lot more to life than this. And we all kind of follow, well, not all of us maybe, but I followed like a kind of traditional, get a good job, get yourself sorted, get your house. And you don't need to follow that path. It's one of those things. If an opportunity comes, take it with both hands. If it suits you, and if it's something you want to do, and what have you got to lose? Because life is so short. It's so short. And when something like this happens to you, it really makes you think, Jesus, like, I need to make more of this life. Any opportunity that comes up now, I'm just kind of like, grab it with both hands and just go with it. And
I
figure it
think a
out
lot of
later.
people these days are waiting for like the perfect moment, aren't they? When everything, like the
Yeah.
stars are aligned, instead of just sort of going for it, like you say. If it feels right, if it's something you want to do, life's too short, just go for it.
Because that perfect moment may never come, and then before you know it, it's too late, and you've missed your chance. Um, and you're in control of where you stay alive to at the end of the day. So I think you have to really just go for it. Yeah.
Love that message. So, a last one then. What is one message that you want to leave everyone with listening today?
Oh gosh. A difficult question. Um, I think if I could leave one message, it would be that, in relation to my situation, I can't change what happened to me, but I will look at it like this. Like, kintsugi, you can be rebuilt into something bigger, something stronger, something braver, and even more beautiful than before. So take those hardships with you, run with it, go right through it, and you'll come out the other side more powerful, and hopefully more happier than before. It's a long road, but you'll get there, and rely upon your support network or reach out to somebody, whether it's someone in your support network or a community, because there's always somebody there that's going to listen, because you're not alone in whatever you're going through.
Great message. Sophie, thank you very much for coming on and sharing your story today. I really appreciate
Thank you so much. Thank you.
Where can everyone find you on social media?
Yeah, so you can find us either Butterfly Care Collective or Sophie Maj XR.
I'll put all those in the description below. But thank you very much for listening. If you enjoyed this one, drop a like. If you're new, subscribe, and I'll see you in the next one.